Hi everyone, my name is Daniel Kurzweil. I'm the product manager for Mama Ann, and on today's webinar we'll be walking you through all of the different features of Mama Ann and how to set up Mama Ann in different birthing scenarios and go through all of the different features. So starting at the head, we have blinking and reactive eyes. You also have seizures that are coming from the head as well, and those seizures sync up with the eyes that blink. So the nose supports a nasal cannula as well. You can intubate her, so she has a realistic airway that you can intubate. The ears support a nasal cannula, so you can actually hook those nasal cannula around the ears. Moving towards the neck, we have pulses. So starting at the neck, we have the carotid pulses. We also have brachial pulses, radial pulses, femoral pulses, and pedal pulses bilaterally on Mama Ann. On the chest, you can also auscultate the heart and lung sounds, both front and back. We do have the ability to use ShockLink for defibrillation. Then moving down to the arms are very similar to Nursing Ann Simulator if you've used that product before, but we've added some upgrades to them. So on the shoulders, you have an IM and an IO injection site in the shoulder. You also have a locking mechanism on the back. So let me take off our BP cuff here and show you guys. So on the back, she does have a little locking mechanism here. So this, you can actually rotate this 90 degrees and that'll lock the arms in place, okay? So that'll really help a lot if you're putting her in an all-fours birthing position, okay? So that helps a lot with the stability. Of course, the arms are fully articulating, so really good rotation and flexion of all of the all of the joints. Okay, you have two IV sites, so one here and one here. You can use our simulated BP cuff so to hear the blood pressure and actually take a real measurement there. So now moving towards the belly and all of the features that are on the belly, you have palpable contractions towards the top of the belly. You can also palpate the boggy and firm uterus. You can switch between the two states within LEAP, so there's no hardware or any parts that you need to swap out. Everything is controlled within the instructor application. So boggy and firm uterus, you also have a 3-directional suprapubic pressure sensor towards the bottom, left, right, and center. So if you're doing a shoulder dystocia scenario, you can make sure that your learners are pushing on the correct side of the pubic symphysis depending on the rotation of the baby. You also have the ability to auscultate the fetal heart tones with an actual fetal Doppler, as well as with the stethoscope, but you can use the fetal Doppler here as well. All right, so now moving towards the legs, I can show you guys a little bit about the fluid system here. So to open the fluid reservoirs, there's just a latch over the left leg here. So all I need to do is just lift the latch and we're good to go. So now I have access to the urine and blood reservoirs. To disconnect them is super easy. It's just one button, just like that. The urine reservoir pops out. To fill this, I can just unscrew the cap and then go to the sink to fill it. Maybe put some coloring in there if I wanted to, and then good to go. Same thing with the blood reservoir. So I just one button to disconnect, and then I can just take it by the strap, go to the sink, unscrew this, and then put some blood concentrate in here, fill it up, and then give it a little shake, and we're good to go. So now I can just slide this back in here and connect, and cover. And now our fluid reservoirs are filled. All right, so now that we've gone through the fluid reservoirs, I can show you a feature that we have on the right leg here, which is the IM injection site on the right thigh. So we can actually go through the whole protocol of cleaning the area and then go ahead and doing our injection. So I'm going to go ahead and clean it. Okay. And then I do have my injection here. So I can go ahead and insert the needle all the way, and then inject the fluids here as well. All right, so now that we're done with the right leg, let's go ahead and load the baby and get ready for our birth. So first thing you're going to do is expose the belly. Then we are going to open the belly, and to do that, there's just one latch at the top, just like that. Going to put the belly to the side, take our beautiful baby here, along with the placenta, and then we're going to start lubricating the baby. And one pump of this lubricant should be more than enough to lubricate the baby. We've developed a new lubricant that lasts a lot longer, so you should only need to lubricate the baby once every 10 births or so. So really awesome new product that we're coming out with alongside Mama Ann. All right. And then once the baby is lubricated, you're going to take the placenta and put it in the placenta pocket down here. So there's a nice little compartment for it. You're going to put as much of the placenta in there, or the umbilical cord, as you can. And then you're going to load the baby head first, tuck in the limbs, and then push that baby back into the clamp, just like that. All right? And then once that's done, you can just cover the baby up, and you're good to go. All right, so now that we've loaded the baby, we can go ahead and start the birthing process for Mama Ann. And while that's going on, I can talk a little bit about the LEAP software and the instructor interface. So we've made quite a few iterations to LEAP. So now we've actually made it possible to synchronize the sounds right on cue. So as Mama Ann is going through that contraction and you can hear that audible sound, I can actually feel the contraction at the top of the belly, and that is also synchronized with the movement of the baby as well. So we can actually see here that the baby is starting to crown. Okay, so really awesome stuff. You can, of course, select kind of how quickly you want the baby to be delivered, whether that's one contraction every 10 minutes, one contraction every minute. So that is all up to the instructors to kind of set those learning objectives and how long you want that simulation to run. All right, so we're going to wait on our second contraction here. Should be in a few seconds. Also, just to note about the legs, so these legs also articulate really well. So if you're doing a shoulder dystocia scenario and you want to do a McRoberts maneuver, we have one more contraction. So here's that head delivery. One more contraction will fully deliver that head. Right now this is about crowning, so one more contraction and that head should be fully delivered and do a restitution as well. So I didn't talk about this while we were loading the baby, but that module that you saw that we actually clamped that baby into, that does all of the pushing and the rotating and even the pulling. In the case of a shoulder dystocia and you want to see turtling, all of that happens with that module. So there's nothing manual, no wires, nothing like that. You just kind of load the baby, and it doesn't matter if you want to deliver OA, OP, or shoulder dystocia, that clamp and that module will do all of those things. We do have a separate module for breech, and I'll show you guys how to install that. It's extremely easy on the next birth. So just going to support the head here. And we can see the baby's head does restitute. And then at this point, I can go ahead and deliver the baby. The clamp is released. But we're going to take more of a hands-off approach and let it do one more contraction. And then we should be able to deliver that baby very easily after that. Okay? So as I was mentioning before, if you're doing a shoulder dystocia scenario, these legs, you can put them in McRoberts really well. So, a lot of flexibility here to extend the hip joints here. And then, yeah, so really, really nice flexibility in all of the limbs. Should have one last contraction here. There we go. So the Mama Ann will deliver the baby essentially to the shoulder mark, kind of like that lower scapula area of the baby, and there are palpable landmarks for that on this baby. So once we get to about this position, we can go ahead and kind of push down and then back up and deliver this baby. Yay. So now the baby's been delivered. Good, and we hear that baby crying. Awesome. And then now we can go ahead and do some light traction to deliver this placenta. All right, so Mama Ann's baby will come with a cuttable section of the umbilical cord. So you can actually clamp this in on both sides here and then cut it in the middle. And once you're done cutting, you can actually just remove it like that from the other side as well. And then this goes in the trash and you can replace it with another one. So Mama Ann will come with 5 of those cuttable pieces. Of course, you can purchase as many as you need if you want to go through that learning objective of clamping the umbilical cord and doing that cut. All right, perfect. So we've gone through a normal delivery. Now I'll show you guys how to set up a breech birth. It's very easy. First thing you're going to do is open the belly, okay, with that one latch. This breech puck we have here. And to replace these is very, very easy. On both of these pucks, there's a little latch here on the back. So I just need to lift and slide in the breech puck. And that's it, ready to go for a breech delivery. I can then take the baby and the placenta, load the placenta the same way I did before in that placenta pocket. Okay, and then with the baby, I'm gonna go butt first this time. And then tuck in the limbs. There we go. And I can load the baby in whichever direction I want. So if I wanted to load it face down, I can do that. If I wanted a 90-degree angle, I can do that as well, or full 180 face up. And then once I have this baby loaded, just go ahead and cover it. And we're good to go for a breech birth. So now, like I mentioned before, it's really nice now that we have the synchronized sounds with the palpation of the contractions. You can feel that contraction here. And the movement of the baby as well. Awesome. And then we're going to go through about 3 contractions here before the baby is fully delivered. In this breech birth, it'll actually push the baby all the way again to the shoulders. One nice feature that you have in LEAP as well is the ability to deliver now. So if your simulation maybe was supposed to be 15 minutes long and you wanted to quickly switch to, oh no, that baby's coming right now. So you can click deliver now and it'll go ahead and deliver the baby fully. You also have the ability to change the distances and the rotation of where that baby is after each contraction within some of the settings in LEAP. So you can really customize how far and have a lot of control over that delivery. All right. Here we go. So here's that last contraction here. Perfect. Maybe one more. I think that should be about it. That's about at the shoulders. So I can go ahead and come in here and help deliver that baby. Perfect. And help that baby cry. Perfect. All right, baby's doing good. All right, so that's how you run a breech birth on Mama Ann. You can also catheterize Mama Ann. You can use a Foley catheter as well. Okay. So you can go ahead and insert this catheter here. Feed that through, make sure we're here. There we go. Okay, so we can already see fluid is coming out, even without the Foley being inflated, but you can inflate that Foley as well. Okay, let's go ahead and stop urine. Perfect. All right. We'll go ahead and pull that out. Nice and slow. Okay. So now, now that we've done that, let's go through some of the bleeding options you have with Mama Ann. So like I mentioned before, there's an internal blood tank of 1.5 liters. There is also an external blood tank that'll come with Mama Ann. So I can show you what that looks like here. Yeah. So you have a 5-liter external blood tank. You can run back-to-back PPH scenarios without needing to refill any tanks. So that was the idea, is to make it as easy to use as possible for the sim technicians, and make sure that you fill that tank once in the beginning of the day, and you can do 2, 3, 4 PPH scenarios without needing to refill. Okay. One feature that we didn't really know was a feature until we went to a customer site to test this was they actually mentioned that they used the external tank for the blood, while the internal tank was used for cleaning fluids. So they would put water and alcohol in there to flush the system. So it was a really interesting use case that we found. Maybe you guys will do the same. But you do have the internal blood tank and the external blood tank to use. Awesome. So I'll go ahead and deliver this placenta here. Okay. So to set up that blood tank, automatically Mama Ann will select the internal blood tank if the external one is not connected. So if it is connected, it'll automatically switch to the external one, and that is a mechanical switch. So even it's not software related. So the second you plug in that external tank, automatically is going to switch to the external. The second you unplug it, it'll switch to the internal. So I'll go ahead and open the belly here and show you those plugs. Okay. So what we've done is actually ran the tube underneath the skin. There's routings for putting this tube there. And then this just plugs into the port right here. So all you have to do is clip that in, and you're good to go. So it's kind of routing underneath the skin, through the shoulder, and then we've actually hidden it underneath the pillows. And you can do the same in your simulation center, just so maybe students are less confused. There's no extra tubes, in different places. So we've thought about that and made it as seamless and kind of covered as possible. So we've just connected the external tank right here. And then you have 2 bleeding options when it comes to where the bleeding is going to come from. So you have what's called a clean bleed mat, and that looks like this. So this mat actually comes from Limbs and Things and is an awesome tool that we've used with Mama Ann. And of course, we've developed this product with Limbs and Things in kind of cooperation with them. So this clean bleed mat is an awesome feature. You essentially plug in this mat to the other side. So just kind of clips in there. The blood is going to come through this. You'll set this up pretty much like a chuck pad, right? So you'll put it underneath the mannequin, and then the blood will run straight into this bag and will kind of seep through this white cloth and look really realistic as the blood is kind of seeping through that. So that's one option. The other option we have for bleeding is if you wanted a bit more messy and realistic approach, you can use the internal uterus that we have. So here's that uterus, okay? So this is kind of the body of the uterus. Here's more the vaginal canal. So this essentially just slides in, okay? Just like that. You're gonna put that kind of end part through there and feed it through, okay? And then this clamp just slides in like that, okay? And then again, you're just gonna take this and then connect it there, okay? So once we put the belly back on, then you'll be able to start the bleeding, and then the blood is going to come into this uterus and flow out of the actual vaginal canal. Now, the really nice part about this uterus is that you can use a few different devices with this uterus. You can use a Bakary balloon, which will stop the bleeding. You can also use a JADA device, and that will also stop the bleeding. And it works very similarly to how it works in real life, where you will start kind of a vacuum and it'll suck out all of the blood from the uterus and create a vacuum to try to collapse it and help firm it up. Okay, so very similar things happen here, but of course the contracted uterus feeling on Mama Ann is actually encapsulated within the belly. But a similar physical thing happens with this uterus. Okay, awesome. So actually, let's run some blood. let's do it. Okay. So we'll start off with the uterus here since we already have it connected. And we'll go ahead and cover this. So right now we have the uterus set to boggy, okay? So as you can see, as I'm kind of massaging that uterus, there's quite a lot of give, right? So this seems quite boggy right now, okay? So boggy uterus probably means that there's some bleeding happening. So let's go ahead and turn on bleeding. Okay. And then in LEAP, while we're waiting for that bleeding to start, in LEAP you can actually set it so if your learners are doing uterine massage and massaging that uterus when it's boggy, you can set it so it automatically firms up if it detects that the uterus is being massaged. All right. So now we have bleeding started here. And just like a real patient, right, the blood might kind of seep underneath towards the butt area. So I'm going to go ahead and try to get that fluid to come a little bit more forward just to give a little bit better representation of the bleeding. But you can see the blood is coming from that uterus through the vaginal canal and then dripping down here and seeping on this chuck pad. So just like in a real PPH scenario, you can take this chuck pad once the bleeding maybe dies down a little bit and go ahead and weigh it and do that quantitative blood loss. So now bleeding is happening. Okay, that's my indication. All right, let's check out this uterus. So I'm going to go ahead and give it some massage. All right. Yeah, and I can feel that uterus already starting to firm up here. Okay. So now we can see I'm putting about the same pressure as before. We can see the uterus here is starting to firm up, giving that softball kind of hard feeling here. All right? And now we can see bleeding has stopped here as well. Awesome. So now we can go ahead and replace that chuck pad, put in a new one. So before we move on to the clean bleed mat, I did just want to mention one additional feature you can do with the internal uterus. So we are going to be including a placenta here that has a retained piece. Okay, so this has a magnet inside this retained piece that fits very nicely here. Now what you can do is actually put that retained piece inside the uterus. Okay, so we won't do it here, but essentially what you can do is put the retained piece of placenta inside the uterus, and there's a magnet here at the top of the uterus. So this would actually be inside. It'll attach right there, and you can actually go through doing a uterine sweep of the uterus and getting that retained piece of placenta and delivering it. And that gets pretty messy, especially when you have fluids running through this. So it gets very realistic. So yes, you can do a full uterine sweep to get that retained piece of placenta. You can also do bimanual compressions as well. So you can put kind of pressure on the top of the belly while you're putting pressure with a hand towards the end of that cervix to help stimulate that uterus to contract. All right, so we just went through how to set up and use the internal uterus and some of the clinical features that we were able to perform with this uterus. Now we're going to go ahead and switch to the clean bleed mat and show you that solution as well. Okay. While we're doing that, we'll also switch over to the internal tank. So we have the external tank connected right here. We're going to go ahead and just click this button, and then that disconnects it. We'll just move it over to the side for now. And then same thing on this side, just push to disconnect, and then unlatch, and then the uterus will just slide out. Okay, so here's our uterus. We're going to go ahead and put this to the side. Perfect. Now here's our clean bleed mat. So first thing we're going to do is go ahead and connect this to Mama Ann. So same type of connector, going to go through the external port there. Now you also have routing for this tube as well. So if I wanted to, I can just kind of take off the skin on this side and then run it here and cover it. Okay. And then I'll go ahead and feed this underneath here. Okay. Perfect. So now I can set up this clean bleed mat. So if I'm running a PPH scenario, I can actually go directly from a birth to a PPH without having to reconfigure anything. So right now, as I have it set up, let's say there was a baby in there, I can go ahead and deliver that baby and then directly go into a birth with this clean bleed mat without having to lift the belly, without having to reconfigure anything at all. So that's why this solution is super important. If you wanted the fluidity within a scenario to go from a birth directly into a PPH, you can do that with this clean bleed mat. So really awesome solution. Let's go ahead and start bleeding. I'll give you guys a little visual of what this looks like. There we go. Awesome. So we've started bleeding, and now all of the blood is going to be contained within this bag. So there's no mess to clean up. You'll keep all of your sheets pretty clean, which is really, really nice. So now you can see that blood coming into the clean bleed mat and then kind of expanding out with the sheet that's in here. And we'll be including 2 clean bleed mats with every Mama Ann. That way, if you're running a PPH scenario, you can actually take this and do a quantitative blood loss and see how much blood has been bled. And then while you're weighing one mat, you can start using the second one. So we'll be including 2 kind of plastic sheets like this, as well as 10 of these reusable white sheets. And these clean out really well. All I need to do is use some soap and water, and they clean pretty much as white as this. So yeah, really nice, awesome product here. Cool. All right. Let's go ahead and stop bleeding. Okay. So no mess. I can just lift the belly and disconnect the clean bleed and take that through. Perfect. Close this belly again. And then I can take this clean bleed mat, and we do have that chuck pad underneath from our previous scenario, so we can take that too. All right, so we went through how to set up the uterus and how the uterus can become boggy or firm. We've done some bleeding. Now we can go through some of the clinical things that you can do to help mitigate bleeding as well using that internal uterus. So we have a JADA device with us here. So just like on a real person, you would essentially insert this into the main part of the uterus and then leave this part towards outside of the cervix. Then you would go ahead and inflate this to kind of seal off that cervix so blood stays in the uterus. And then you would go ahead and connect this to suction to allow this to start sucking blood from the uterus and helping it contract. So I can go ahead and insert this. All right, so I'm going to go ahead and go, and there is a cervix in this uterus that we've designed. So good, and we're bleeding here. Awesome. Okay, so right now I have that balloon kind of right outside of the cervix. I'm going to go ahead and add the fluid here. Okay. All right. And then that should seal off that vaginal canal. So now that essentially stops the bleeding. So then once I have that connected, I can go ahead and connect my suction here as well. So this will just pop on like that, start the suction, and then that'll start bringing that blood from the uterus into that suction tank. All right, so then we can go ahead and undo that. Okay. That fluid back. Perfect. And then the JADA can easily be removed. And then the same thing can happen with a Bakary balloon as well. So you would essentially do the same thing. You would insert this past the cervix into the uterus, inflate this with fluid, and then kind of pull back a little bit. and then that'll create that seal, and then the blood will flow through this tube into a drain bag. Awesome. All right, so we've gone through an OA birth, a breech birth, and we've done a PPH. Now let's switch to a shoulder dystocia. Okay, so the last one we did was a breech, so what I'll need to do is change the puck. So I'm going to lift the belly. Okay, I'm going to grab my cephalic delivery module, and just like before, just slides right out, and this one slides right in. Okay, so super easy to change those out. I then just take my baby and I load it exactly the same way as I did before. Okay, so placenta in the placenta pocket. Okay, and then baby goes head first, and then tuck in that umbilical and all of the limbs, and then slides right in. Okay, so this is the exact position that you're going to load the baby, whether it's an OA, OP, or a shoulder dystocia scenario. This is the way that you'll load it. This module is going to be what does all of the pushing, the rotating, and even the pulling back in the case we're about to see now with the shoulder dystocia. All right, so we'll go ahead and cover this up. We'll go ahead and start the birth. All right. So we're running a shoulder dystocia scenario. What are some of the features that are kind of applicable for this type of scenario? Well, besides the contractions, right? So you'll be able to feel the contractions as that baby starts pushing forward. A boggy firm uterus, just in case that shoulder dystocia starts turning into a PPH scenario, you can feel that. But there's also that suprapubic pressure sensor that I was talking about before. So we're going to go ahead and do this delivery, and we're going to keep an eye on which way that baby is rotated and push on the correct side depending on which way the baby restitutes. All right? All right, I think that second contraction is about to come right now. There we go. So still crowning here. And really the nice part about LEAP is that a lot of this is customizable. So if you see, the standard delivery that comes with Mama Ann, you can actually customize it on the position that that baby is at in different contractions and different phases. So all of that you can definitely set yourself. And yeah, each institution is maybe going to want to teach a little different learning objective. So all of that is definitely customizable for you to kind of do yourself and get that delivery going. All right, last contraction here, really good. So now we see the head is delivered, and then we're starting to restitute here. Okay, I'm gonna go ahead and support the baby a little bit, just because I feel bad. Okay, and now we can see that baby's head is starting to turtle. Okay, it's starting to go back in. Okay, so that is now my visual indication. All right, this is a shoulder dystocia scenario, and we can see the baby's head is restituted to the mother's right side. So what we're gonna do is actually push on the left side of that suprapubic bone to try to kind of bring that shoulder in rather than try to extend it and get it stuck further. So we're going to push on this side here. All right. Perfect. And then on LEAP, the instructors will be able to see whether I've done that suprapubic pressure correctly or not, or at least on the correct side. Okay. All right. So now I should be able to deliver the baby. Now, the baby's not going to release until the instructor essentially releases the baby. So one would be to do the suprapubic pressure. Another one would be to do McRoberts. So ideally, I would have another person here with me, but I can go ahead and lift the legs of Mama Ann and do that pressure here. Okay. And now we're going to wait for one more contraction and see if all of those interventions helped. See if I can feel that contraction coming. Yeah. Perfect. All right. All right, and there we go. Baby was released. And then I can go ahead and do some light traction again to help deliver that placenta. All right, so that was the shoulder dystocia. So really cool to see all of those different features that Mama Ann includes. We have the suprapubic pressure, we have boggy and firm uterus. It senses whether you're doing that uterine massage or not. You can feel the contractions. All of these different really high fidelity features to make sure your high fidelity simulation runs as smoothly as possible. I want to thank everyone for joining today's webinar. Again, my name is Daniel Kurzweil, the product manager for Mama Ann. It was a pleasure walking all of you through all of the different features of Mama Ann and different scenarios you can run with her. If you have any questions, definitely feel free to reach out. I'd be more than happy to help.